Hello, and let's talk about C-section scars and how we can start managing a little bit of releasing the tissue, the scar tissue that goes on and can bind us down. I'm wearing this hoodie here, and I'm going to use the zipper as the clearly visible scar. Not every C-section scar is going to be from the navel on down. Sometimes you get the C-section scar coming across. Depending on which one you have, it should be the same implications of massaging the scar. I have a nice scar here on my knee from my ACL surgery, and I got another one up here when I walked into a construction truck. So the concepts apply the same way for massaging the scar. And again, using the zipper, cross friction. So if the scar runs this way, I want to work left to right fashion. If the scar were to run, again, from left to right, I would work up and down and going against the grain, so to speak. So if it's going that way, I'm going to go and work up and down that way. If it's the first time you're doing it, obviously we want to start out pretty light. If you want to desensitize it, if it happens to be sensitive, we can use different fabrics. So I'm going to grab a few different things here. I can use something like a sock that's a little softer and use that to start to minimize or lower the intensity of that massage. Then I can maybe go to something a little more serious, like a denim. So it's going to have a little more texture to it, and we can work on that. And we can work our way all the way up. Obviously, again, if we can use our fingers, if you can have a partner work on it, it might help to push through some of those limitations. If there is some sensitivity, you can start by working on your breathing through it. So if we're working there, you can breathe through it. So if there is some pain associated, we need to go through that barrier, and it is safe to start to break through that. Of course, it is possible to do a little too much. It is possible to push into too much pain, so we're not looking for that. We're always working to consult and communicate on how we can do this, especially in this remote setting. So if you've never had a clinician work on your scar, something that, again, you can go and find plenty of great clinicians in person to play around with that and see how it feels, so that when you're doing it on yourself, you can kind of know how it feels. If you're comfortable on your own, again, I would encourage you to get started and just consistently doing that throughout the day, a few times a day, again, even for 30 seconds, just to get things moving. So it's just like a wrinkle in the shirt, right? If I have a wrinkle here, that can be, and if it's pretty bound up, that can be affecting all the way up. You can see these fabric fibers coming all the way up to my shoulder. That's going to pull on it. If I can loosen that up, it's going to improve things. Again, when you have that C-section scar, what it can do is it's going all the way into the low back. There's a lot going on in here. So we're looking to release that so that you can start improving how well you breathe, all the way into the belly, always reminding you to breathe better. And again, that scar is something that might be inhibiting how well all this stuff is moving and working. So hit me up if you have questions. Let's make sure we're moving in the right direction, getting you 1% better every day. We'll talk soon.